This recording will go over medications used to treat heart failure. When the heart muscle or myocardium weakens and enlarges, it loses its ability to pump blood through the heart and into the systemic circulation. Heart failure can be left-sided or right-sided. The patient has left-sided heart failure when the left ventricle does not contract sufficiently to pump the blood returned from the lungs and left atrium out through the aorta into peripheral circulation. This causes excessive amounts of blood to back up into the lung tissue. Usually the patient has shortness of breath and dyspnea. Right-sided heart failure occurs when the heart does not sufficiently pump the blood returned into the right atrium from systemic circulation. As a result, the blood and its constituents are backed up into peripheral tissue, causing peripheral edema. Myocardial hypertrophy results in cardiomegaly, increased heart size, and can be a major problem associated with chronic heart failure. In the cardiac physiology of heart failure, an increase in preload and afterload occurs. The increased preload results from an excess of blood volume in the ventricle at the end of diastole. This occurs because of pathologic increase in the stretching and thickening of the ventricular walls, which allows a greater filling pressure associated with a weakened heart. Increased afterload is an additional pressure or force in the ventricular wall caused by excess resistance in the aorta. This resistance must be overcome to open the aortic valve so that blood can be ejected into circulation. So to say it simply, preload is the volume of blood in ventricles at the end of diastole, and afterload is the resistance the left ventricle must overcome to pump blood out into circulation. Non-pharmacologic treatment of heart failure includes limiting salt intake. The patient should limit salt intake to 2 grams per day. Alcohol intake should be either decreased to 1 drink per day or completely avoided because excessive alcohol use can lead to cardiomyopathy. Fluid intake may need to be restricted. Smoking should be avoided because it deprives the heart of oxygen. Obesity may increase cardiovascular problems if it's associated with unhealthy behaviors. Thus, obese patients should modify their behaviors as needed. Saturated fat intake should be decreased. Mild exercise such as walking or bicycling is recommended. Lab tests used to monitor for heart failure include atrionatriuretic peptide and brain natriuretic peptide, ANP and BNP. The normal value for ANP is 20 to 77. BNP is considered a more sensitive test than ANP for the diagnosis of heart failure. BNP is frequently talked about or used in the clinical setting, so it's definitely a lab value that you want to be familiar with and to know the regular normal value of it. So the desired value for BNP is less than 100. And BNP can be looked at to help differentiate lung issues, to figure out if it's a lung problem or a heart problem. So you have a patient that comes in with dyspnea and we're not sure exactly what's going on. Their BNP is normal. It leans more to it being a lung problem. Their BNP is elevated. It leads us to think it might be more of a cardiac issue that's causing problems with breathing. BNP is also something we can watch in the clinical setting when the patient's being treated for heart failure. So they're going to be getting these medications that we're going to talk about in these lectures, and we'll watch that BNP trend down as the medications are effective in helping to treat the heart failure. Cardiac glycosides are classifications of medications that are used to treat heart failure. Your prototype cardiac glycoside that you need to be familiar with is digoxin. Cardiac glycosides are also sometimes called digitalis glycosides, and they work by inhibiting the sodium-potassium pump, which results in an increase in intracellular sodium. This increase leads to an influx of calcium, which causes the cardiac muscle fibers to contract more efficiently. Digitalis preparations like digoxin have 3 effects on the heart muscles. They promote a positive inotropic action, which increases myocardial contraction and stroke volume. So when you hear positive inotropic means the myocardial contractility. So positive means that it's increasing that myocardial contractility, which equates to a stronger squeeze of the heart. So positive inotropic means that the heart is squeezing better. Another thing it does is it's a negative chronotropic action, which decreases heart rate. So when I see that chrono, that suffix, I think of like chronological numbers. So we're talking about the numbers of beats per minute. A negative chronotropic action would decrease heart rate. And also a negative dromotropic action decreases conduction of heart cells. So it decreases the conduction of that impulse, which leads to the decreased heart rate. All of these things, a stronger squeeze, a slower heart rate, they help to increase stroke volume and increase cardiac output. They help the heart to pump blood out and do a better job at that. The better squeeze obviously speaks for itself. It does a better job at squeezing the blood out. The slower heart rate, what that does, the ventricles fill during diastole. So if I have a slower heart rate, it allows more time for filling of those ventricles, and then we have the better squeeze, which helps push out more blood to help increase cardiac output. The increase in myocardial contractility strengthens cardiac, peripheral, and kidney function by enhancing cardiac output, decreasing preload, improving blood flow to periphery and kidneys, decreasing edema, and promoting fluid excretion. As a result, fluid retention in the lungs and extremities is decreased. So again, digoxin is your prototype cardiac glycoside. We're talking about it being used to treat heart failure. It works by inhibiting the sodium-potassium ATPase, promoting increased force of cardiac contraction, cardiac output, and tissue perfusion, and decreasing ventricular rate, or that heart rate. Some side effects that are listed here include bradycardia. We already talked about the negative chronotropic properties of this drug, right? We know that it's going to slow heart rate down. So a side effect of bradycardia isn't that surprising. And it's very important with digoxin that we actually take an apical pulse for a full minute prior to administering it. And if the apical pulse rate is less than 60, the medication needs to be held. Overdosing or accumulation of digoxin can cause digitalis toxicity or dig toxicity. Signs and symptoms include anorexia, diarrhea, nausea, and vomiting, so some GI issues. Bradycardia is a big thing, so you got to associate that bradycardia and know that that's something you're watching for with digoxin. Premature ventricular contractions or other dysrhythmias, headaches, malaise, blurred vision, or other vision issues such as white, green, or yellow halos around objects, confusion, and delirium. Phenytoin and lidocaine are effective in treating digoxin-induced ventricular dysrhythmias. The therapeutic serum level for digoxin is 0.8 to 2. And I try to write on this PowerPoint to show you what I normally would write up on the board. So with digoxin, to help remember that 0.8 to 2, when I write out digoxin, I write the DI, and for the G, I actually make an 8. And I write the O, and for the X, I make a number 2, IN. So that, to me, is a visual and a reminder that 8 and 2 play an important role in the normal serum therapeutic value for digoxin. The decimals you have to remember on your own, so it's 0.8 to 2 is your normal therapeutic value for digoxin. Anything greater than 2 is indicative of digitalis toxicity. So we've already gone over those signs and symptoms of dig toxicity. There is an antidote for dig toxicity, and it is digoxin immune fab. So that's something you have to remember anytime there's an antidote for any overdoses or toxicity. So the antidote for dig toxicity is digoxin immune fab. In terms of dig toxicity, low potassium levels puts the patient at an increased risk for dig toxicity. Drugs that can cause low potassium include diuretics such as furosemide and hydrochlorothiazide, as well as cortisone preparations. Antacids can decrease digitalis absorption if taken at the same time. To prevent this problem, doses should be staggered. Please be sure to spend some time to review your Purple Nursing Process box on digoxin. It has a lot of good information. So in terms of assessment, a big thing is knowing our baseline pulse rate, right? Because we know we need to hold the drug if the pulse is less than 60. We need to be monitoring that pulse. We need to get a drug history. We need to know if the patient's taking medications that will lower potassium levels, such as diuretics or cortisone, because that low potassium puts the patient at increased risk for DIGE toxicity. And then we need to know the signs and symptoms of DIGE toxicity, which you can review again on your own. In terms of problem, what is our problem? Our problem is decreased cardiac output because our heart's not working right, which also then leads to ineffective tissue perfusion. In terms of planning, we want to make sure that our patient is checking their pulse rate daily, and they know that if it's less than 60, they need to hold that medication. In regards to interventions, again, if the pulse rate's less than 60, we need to hold it. We want to look for signs of peripheral or pulmonary edema. Those are signs and symptoms of heart failure. Monitor serum digoxin levels. Again, the normal range is 0.8 to 2. Greater than 2 is indicative of DIGE toxicity. And then monitor our serum potassium levels. You should know the norms 3.5 to 5. And we're monitoring those again because hypokalemia pushes the patient at greater risk for DIGE toxicity. We want to make sure that our patients know they need to check their pulse rate before taking DIGE and to notify the healthcare provider if pulse is irregular or if the pulse rate is less than 60 and not to take the medicine if it's less than 60. We want to make sure the patients are aware of signs and symptoms of DIGE toxicity. And we've been over those signs and symptoms, so you can review those on your own. And then in terms of diet, advise patients to eat foods high in potassium, such as fresh and dried fruit, fruit juices, and vegetables, including potatoes. Another classification of medications that can be used to treat heart failure are phosphodiesterase inhibitors. Phosphodiesterase inhibitors, sorry about that. Your prototype phosphodiesterase inhibitor that you need to know is milrinone lactate. It works by inhibiting the enzyme phosphodiesterase, and it results in a positive inotropic effect. Remember, that's the better squeeze of the heart, which leads to increased stroke volume and increased cardiac output, which is what we want. It can also promote vasodilation, which is helpful. It is administered IV for no longer than 48 to 72 hours. Severe cardiac dysrhythmias may result from the use of PD inhibitors, so the patient's ECG and cardiac status should be monitored closely. Milrinone is a high alert medication that may cause significant harm to a patient when given inappropriately. And then finally, I just want you to know that these classifications that can also be used to treat heart failure. So vasodilators, angiotensin converting enzyme inhibitors or ACE inhibitors, angiotensin 2 receptor antagonists or ARBs, diuretics, and some beta blockers. So just know in general, these categories are also used to treat heart failure, and we'll talk more in depth about these different categories in a different lecture.